I found radiology to be a very powerful way to understand disease, understand what's happening to specific patients, but also to understand why the disease involves certain patients and what it does to certain patients, to try to move that needle further and how we can actually provide the best care we can for our patients. One of the things that I really enjoy about being a radiologist at Washington University is that it's a historic department. It's one of the oldest departments of radiology that has been there at many of the major times when imaging has really advanced. So for example, Washington University played a very big role in pioneering PET scanning, which obviously has a very important role in the care of cancer patients. And we get to continue to push the boundaries of imaging. As part of our team, not only physician radiologists who make diagnoses from all these scanners, but we also have physicists who are top experts in understanding how to use these state-of-the-art scanners. We have researchers who are really at the top of the field and pushing the envelope and trying to understand how can we get more and more information from a CT scan or a PET scan or an MRI scan. And then as the physician radiologist, I get to take that information and help it benefit our cancer patients. And that's very, very exciting. My research lab is very interested in trying to understand brain aging, and we are studying brain aging using imaging tools, the same type of imaging tools that are used to study and understand cancer. We study how and why the brain develops different diseases like Alzheimer's disease or vascular diseases like stroke. And all of these different diseases, unfortunately, can cause people to lose their memory and lose their ability to think as well as they normally do. So we're trying to understand those processes, and we think this is actually very important for cancer patients because as cancer care continues to improve, patients are surviving their cancers, but now they're dealing with all of the diseases of aging. And we would love to be able to figure out why that's happening and see if we can help them prolong the effects of aging as long as possible. One of the things that I think makes Washington University a very special place is that it's a very collaborative university. We all know how to work well with one another, not just in taking care of our patients, but also in research. And many of us are good friends outside of the university. So somebody needs to call me on a weekend or in the middle of the night about a patient, I don't mind. But that also gives us an opportunity to mix and match all the different types of research that we're doing. And I think that's very exciting. There's really great advancements in radiology that are occurring at Washington University, but there's also really great advancements in genetics and in new ways to diagnose disease from the blood or from the spinal fluid. And all of that gets to help impact how we devise the best treatments for cancer care. I think Siteman provides a combination of things. One, it provides that team-based approach to your care, where you might be seeing a single oncologist or a single surgeon, but in fact, that oncologist and surgeon has a whole team of physicians backing them up, including, for example, radiologists, such as myself, where we're reading the scans, we're providing detailed information about, say, a tumor in the brain, where it's located, exactly what it looks like, what it might be or might not be. And that information then comes down to your physicians. And since we're all national experts in the care of cancer patients, we can really provide a very high level of care for our patients together. One of the things that drives me as a neuroradiologist is when an oncologist has a vexing question about their patient. And I can tell that they're up at night worried about their patient. Sometimes a clue or even the answer to their question is in their CT scan or their MRI scan or the PET scan. And when they ask me to help out with that, and I can provide some assistance and I can say, oh, look at this little aspect right here, maybe this can answer your question, that really drives what I do.